Welcome. I'm Dr. Emily Helder. I'm a clinical psychologist and a professor of psychology at Calvin University. And my research focuses on adoption and foster care and childhood adversity.
My name is Francie Bailey. I'm a senior at Calvin University studying psychology and occupational therapy. This summer I get the opportunity to do some research with Professor Emily Helder. And I'm particularly interested in the field of adoption. I myself am an adoptee from China.
My name is Schneider, and I am also a senior at Calvin University, and I'm studying psychology. And I also have the privilege to work with Professor Helder and Francie this summer on this research. I've always had an interest in working with children and adolescents, and over the past couple of years, I've also become really interested in adoption. So very excited about the research we're doing.
Awesome. Well, great. So we've decided to make this video in response to a particular case that was in the news that we were all discussing. It is the Stauffer case, and it is a pretty prominent case of adoption dissolution that was in the news a couple weeks ago. We were having discussions just informally together about it and exploring what was out there on YouTube and other places about the case, and felt like we could contribute a bit, especially in the context of including adoption research and talking about some of the themes that emerged from the case and how it connects with some of that research. So we decided to put together a series of videos. This is really just the first. In this one, we'll talk a little bit more about the kind of background context of what's been going on. And then in future videos, we'll link it to specific themes. Yeah. So we thought it would be helpful for everybody. You know, this might not be a case that everybody's familiar with. So we thought we'd start first with giving just a bit of backstory. Why don't one of you tell us, who is Mia Stauffer, the mother, give us a bit of the backstory there.
So Mia Stauffer is a mother of 4 now. So you may have seen the name Huxley kind of spread around social media. That is her adopted son, who was adopted from China at age 2.5 years old. And then recently this year, she has decided to, word for word, rehome Huxley. And that has caused a huge controversy among the adoptive community and even just kind of beyond that. She is a retired nurse, a famous Christian YouTuber who has over 700,000 subscribers, and a large part of her following is attributed to her adoption story and just kind of talking about her experience with Huxley and her preparation and everything post-adoption. Huxley is currently about 4.5, 5 years old, and he does have some developmental disabilities. That was probably the main reason they decided to rehome him. They felt that the disabilities were a little too overwhelming and that they were not prepared.
Mm-hmm. Yeah, so tell us a bit about the Stauffers even before adoption, like pre-adoption. What's their history?
So before the Stauffers adopted Huxley, they actually already had children. I believe they had 3 children at the time, but they were adopting him. And Mia just said that we're like a faith-based YouTube family. And so she said that God really put it on her heart to adopt. And they were very excited about welcoming this new little boy into their home. And she and her husband, Jimmy, spent a lot of time researching the ways that they could go about adopting. And they looked at first into foster to adopt, and her husband actually was pretty opposed to it just because he wasn't sure he could handle a child potentially being taken away from him. And so immediately he was not really on board with that. And so they decided to pursue international adoption so that the child would be in a forever home. And they thought that that would be the best option for their family. And they chose to adopt from China because she already had 3 children and was a little bit older. So it was one of the only countries that would allow them to adopt. And because of her history with already having children and being older, they were more likely to have a child that had disabilities. And at first they were a little hesitant about it, but she said in a video that, God again softened her heart, and that when they were told about the realm of possibilities that the child, like different disabilities that he could have, they were pretty comfortable with most of them. And she even said, even if it's something that we can't see, it doesn't matter. He's our son, that's that. We're not going to trade him. We're not going to return him. He's our boy. And she said in another YouTube video that she was not afraid of having a child with disabilities, partially because she was a nurse. And so she was actually trained in handling a lot of different things. So she thought she'd be prepared, and even said that out of 100 different disabilities, that they were all right with 99 of them. So she felt pretty confident at first. And she said in quite a few videos that her child's not returnable and that they were in this for the long haul.
Yeah. Yeah. So walk us through kind of what changed, what happened once the adoption was finalized.
After the adoption was finalized, they took him to see a few specialists, and a few things that she is reported saying in her videos is after taking him to see several specialists, we discovered that he had a stroke in utero. Every therapist who had treated him had hinted at sensory processing disorder, autism spectrum disorder, ADHD, and global developmental delay. Prior to their adoption, she has been recorded saying that several specialists have recommended not going through with the adoption. She, as a nurse, has this confidence that she was able to handle whatever was thrown at her way. But after diagnosis and after living with Huxley for a bit, their feelings towards Huxley kind of shifted into a little bit more of an irritation towards him.
They talked a lot about different challenges that they had with him, and one of the big themes at first was centered around eating and food. And she said that her husband was particularly uncomfortable sometimes because she said, you can't eat food without him watching you eat, even if he has food in front of him. And for some reason, that drove her husband bonkers. And a lot of the times she would record her son having meltdowns, and quite often, or what she called meltdowns, and quite often they were about conflict surrounding food. So Huxley would want to eat more food, and his mother would say no, and he would become upset about that. And she was not very understanding with him. She'd usually just send him to timeout. And Micah herself actually had kind of an odd relationship with food. In her videos, she was always trying different diet trends, and sometimes she was vegan, sometimes she was vegetarian, and she always tried to include her kids on that to make sure they had like a healthier lifestyle. So I guess, is that sort of like a common theme for internationally adopted children, conflict around food? And do you think that so much inconsistency with the types of food that he was receiving might have caused some issues as well?
Yeah. I mean, that was one of the themes that when we started doing, some looking into it, that really popped out at me. It's very common for kids coming from institutional or orphanage care to experience eating and feeding difficulties for a variety of reasons. I mean, one obvious one is that there's a big shift often in the types of food that the kids are getting in one country or culture, and then in their adoptive home, the food itself is just very different. Sometimes it can be that in orphanage settings, the feeding practices are done often for efficiency, and so it's easier, for example, to give even kids who would normally have solid foods, to give them like a thickened mixture through a bottle, since that's just faster. And so sometimes that can mean that texture of food is really difficult to get used to. And then also there's just food scarcity in some institutions, and so it's really common for kids to hoard food or have difficulty with knowing the cues of when they're full because they, have had that early experience of food scarcity. So yeah, it's really common, especially in the first months to, a year after adoption, to see that. It does usually get better with time, but it's super common initially.
That's interesting. My little brother, he's adopted too from China, and he was adopted when he was 2.5, and my parents remember the first year or so, he would just take a bunch of food and just hide it in his crib.
Yeah, well, I think it's just a good example of the fact that a lot of kids' behaviors right after leaving institutional care might seem odd in a family setting, but really it's pretty adaptive. Like they have learned how to take care of themselves and get what they need. But when you enter into a family setting, that same behavior that was adaptive in a group care setting isn't working in a family setting. Yeah. Yeah. I know too, and maybe you guys can give me a little bit of the backstory too, is that there was some small discussion about some scary things that might have happened with Huxley in the home. So yeah, what kind of information does Micah give about any sort of danger concerns that she had?
She specifically states that she is not going to go into detail about it because she wants to allow Huxley that privacy for when he gets older. So she hints at scary things, she's hinted at dangerous things, but she hasn't upfront said anything. So we can only kind of imagine at this point.
What that is. Yeah. And I think we have plans to talk about that kind of in future videos, but risk or aggressive behavior or whatever isn't a common outcome, among adoptees, but it does happen, that level of safety concern. And there's a variety of different kinds of strategies that we often recommend professionally when that occurs. But yeah, we'll plan to talk about that kind of in future situations. So all of that led up to the adoption dissolution, which Micah calls rehoming, but I just want to emphasize that's not really a term that we use, that's really her term. So yeah, can you give us sort of the context of how that adoption dissolution occurred?
Yeah, so she kind of explains it as this is really the best option for Huxley, and that it's everyone else's kind of suggestion. She thinks Huxley kind of favorited other people over her and her husband. She thinks that the medical professionals were suggesting that it's in his best interest that they kind of give him up and give him to people that could take care of him better. In one of her videos, she explains, Huxley wanted this decision 100%. We saw that in his family time with other people. He constantly chose them and signed and showed tons of emotions to show us and let us know he wanted this. Along with that, she mentioned, after multiple assessments, after multiple evaluations, numerous medical professionals have felt that he needed a different fit, and that with his medical needs, he needed more. So again, she's just kind of attributing this decision to it being in his best interest based on multiple different perspectives.
Yeah, and there's a lot in what you just said, Francie, that I hope that we can unpack in future videos, because both in terms of the professionals and then also Huxley's behavior, I'd like to definitely talk more about that. Yeah, so what's been the result or maybe backlash about this decision that they made?
Yeah, the family and especially the mother, Micah, have received a lot of backlash for quite a few things that center around Huxley. First of all, a lot of people took issue with the fact that she sort of seemed to adopt Huxley for monetary gain. She monetized every single video that Huxley was in on her YouTube channel. And she was essentially making money off of this child before he was even legally hers. For example, her family decided to have a fundraiser where you could purchase little pieces of a puzzle to reveal the child's face. And so each piece that you bought was worth $5, and eventually it would show his face. But this was before the child was even in her custody. They weren't even 100% sure if they would get the child. I'm not sure if he was even legally theirs, which people were obviously very concerned about because it's a child, not like a token, thing. Yeah. And then obviously a lot more controversy arose once she decided to rehome Huxley, because that's just not a super common thing. And he was missing from their Instagram, their YouTube videos, and she gave no explanation of why he wasn't there. So people started to get concerned, and they were wondering where this child was, because she never gave an explanation. And eventually, when she released this video, she didn't really give too much more information about where he was, so nobody actually knew what had happened. And it was just hard because she had, for 2 years, been in videos talking about how she'd never give up on her son, and it seemed like she had given up on her son. Mm-hmm. And then a final way that people were pretty concerned about this adoption case was the way that she treated her biological children compared to Huxley. She would have special biological children time at night with her kids. And she actually ended up having a son or daughter after Huxley. So they had a child who was younger than him and a son that was the same age as him. And these children were allowed to stay up and watch movies with the family, but Huxley had to go to bed. They would go on vacations without Huxley, which was just odd. And there are a number of other things that I think we might discuss in future videos, where one child would exhibit the same behavior as Huxley, and she would respond very differently.
Mm-hmm, mm-hmm. Yeah. I think what all of this, history and, whatever with the case really brings to mind is that there are so many ways this connects with research on adoption and understanding of it. So I'm glad that we're taking the time to really unpack all of this. So just to give people a preview, our hope is to have these future episodes that will talk about some of these themes in more depth. So we're going to talk about what is adoption dissolution really, how often does it occur? We'll talk a bit about motivations to adopt, which is, really came up for this case. What sort of preparation parents get when they're adopting and what should that look like? Ways maybe that we noticed that the Stauffers might have misinterpreted Huxley's behavior and just misunderstood where it was coming from. Yeah, that thing, Ava, that you mentioned about the treatment of biological versus adopted kids, what that should look like. And then, her discussion, Micah's discussion about working with different professionals. I think it's really valuable for us to have an episode talking about adoption competent professionals, what that looks like, why those are valuable. Yeah, and then we can kind of talk about some of the bigger picture things like the parent's role in adoption versus the child's role, some just general social media ethics about sharenting, like sharing about parenting on social media, and then end with an episode looking at what are the future implications of this case. So I'm really looking forward to it. I hope unpacking all of these things in more detail will be helpful for people. So stay tuned, and thanks so much, Francie and Ava.